This is my first ever Q&A session on the subject of prostate cancer, and you're invited to join along.
This podcast deals with prostate cancer, surgery, medication, and other medical topics. The host is a prostate cancer survivor who is recounting his experience with treatment. He is not a medical professional, and you should not use his commentary as medical advice. Please always consult a medical professional when learning about and understanding prostate cancer or any other disease.
Hi, this is Mark, and I want to welcome you to Mark's Prostate Cancer Experience. Today, we're doing something brand new, something special that I've been meaning to do for quite a while. And I think I'll probably do this maybe every couple of months because for those of you that follow my Facebook channel, you'll notice that there's many questions coming up all the time. I don't always have the answers, but there are some things that I can relate to because I've gone through surgery and radiation, and a lot of times your doctors will, they'll give you a clinical explanation of what needs to be done or what you're going through. But I've always found that unless you go through it yourself or speak to someone that has, you don't always get sort of the layman's answer in terms of what's going on and what the experience is all about. So what I did is I collected a number of questions. I don't have a lot for today, but I just figured I would try this as a first session. And if it's popular and you guys like it, we can continue doing it in the future as well. But this session today will be just as helpful whether you're listening or watching or both for that matter. So let's get started right away here. And I'm going to pull up just some of these first questions. And let's see. Okay, let's jump right into it. First question, and I'll leave the identity anonymous of the people who have asked these questions. Okay, so the first question is, how long does it usually take to feel normal again after radiation treatment for prostate cancer, especially with issues like bowel irritation or changes in bowel habits? So this question will relate to radiation for both initial treatment of prostate cancer as well as treatment for recurrence of prostate cancer. So I'm sure most of you are aware of this, but just in case you're not, when you are treated for radiation, there's a beam and they're made up of either X-rays or gamma rays, or I'm not sure, the exact naming of them, but they're basically radioactive waves that penetrate the body. They come in one side, they leave the other side, and it's targeted towards the radiation bed or the prostate. But unfortunately, to get there, it does have to pass through other organs that are nearby. So most notably, the rectum is affected. And, but sometimes it's just, sometimes it's your bowels, it could be your stomach, it could be the various mechanisms that are in there. But what happens for a lot of men is the rectum is very sensitive, and the rectum is right adjacent to the prostate bed area. So what a lot of men will notice is that during radiation, and radiation typically is for prostate cancer, it's about 35 to 40 sessions. So that's Monday to Friday for 6 to 8 weeks. And what I found, and what I hear from a lot of people as well, is usually towards the second half of that, you start to feel some bowel habit irritation or some changes to the actual material, the feces that's coming out. So the question is, how long does it last? Well, what I found, and I think I mentioned in previous podcasts, when I had radiation for recurrence, I had photon radiation, and photon radiation versus proton radiation. So proton radiation are X-rays. The beam goes right through the body. It's the same strength all the way through. So in adjacent tissues and muscles, the strength is the same as the area they're trying to treat. When it's proton radiation, they have a way, and I don't know the science, but the radiation comes into the body, and when it hits the target, when it hits the prostate bed, that's when it unleashes a lot of its power, and then it weakens and it exits the other side. So the theory there is the surrounding muscle and tissue and organs get a smaller dose of radiation than the area they're trying to treat. But nonetheless, the areas do get affected. And when you have radiation, you're in healing for quite a while. And, we have this thinking, and this will relate actually to another question that's coming up, but we'll tend to think of radiation as kind of a zap. They zap the cancer, they zap the cells. And what radiation really does is it poisons. I hate to use the word poison, but it basically, hits the body with radioactive material, and the body will then take that and work with it for many, many weeks and even months. So when you finish radiation, you keep, I guess the best way to describe it is you keep cooking for quite a few months. And so to answer that question, when do you feel normal again? Well, I would expect once you finish radiation, I would expect for the next 30 days to 60 days, maybe even 90 days, you may feel some irritation in your bowels. What I found is, the rectum itself, when it gets radiated, sometimes there are different complications that can occur. One is called fibrosis, where basically it just it like scars, and so your rectal tube, I guess, if you will, before radiation is just this tube. After radiation, it sometimes has some constriction. So for some people, that means constipation. For others, it means that having a bowel movement is a little more difficult. And so anyway, I each of us is going to have a different experience, but if you've had radiation and you're having these issues, the best thing is always to consult with your radiation oncologist. They're going to be your best. But I'll tell you from personal experience, I probably have had about 30 days where bowel movements were a little odd, and then they slowly got back to normal again. So anyway, that's the first question. Next question: how long does it typically take for scars to fade after prostate removal surgery? This is a good one. So most of us getting surgery for prostate cancer will have the Da Vinci robot conduct a surgery. Not always, but in any case, when they remove your prostate, whether it's by manual means or by a robot, they're going to take 5 or 6 rods, and I don't know if this even... Well, I have a little screwdriver here. They're probably about the size of the end of the screwdriver. I don't know if that comes up well or not, but anyway, so you end up with these incisions on your abdomen, and I'm almost 10 years after surgery, and there really is no scarring left. There are some very, very small dings. They kind of look almost like if you cut yourself and it heals, some very, very minor scarring, but it's nothing like when you see someone that has open heart surgery and they have that huge sort of, looks like almost like a zipper kind of down their front. That's not going to be too typical, although I will tell you that there is one area that is larger than the other, and that's where the prostate is actually removed. And it's probably about an inch to an inch and a half, and that leaves a little bit of a scar, but it's nothing crazy. The important thing that I can say on this particular question is eventually, and it might take a year, it could be shorter, it could be longer, but eventually you don't notice that you've had surgery and you don't really even see that there's scarring left. There's that one around your navel, but it's small and it's not benign. It's benign. It's nothing that, if you're in a bathing suit and you're out having some fun, then it's not going to make any impact whatsoever. And nobody will notice that you've had anything done. Okay. Next question. My PSA level has gone up from 5.6 to 7.2, but tests show no cancer. And I have an enlarged prostate. Should I be worried? And what should I do? Well, this is the kind of question that even on this channel, I try to relay my own experiences and the experiences of others that I've spoken to. So this is a very medical specific question. And this is definitely a question that you should ask your doctor With that being said, I do want to make a comment on this, and that is actually a couple things. An enlarged prostate, which is often referred to as BPH, that can cause a rise in PSA. And so if you have a PSA from 5.6 that goes up to 7.2, that doesn't mean you have prostate cancer. It just means there's something that needs being looked at. And there are a lot of times it will just be from BPH, and it's treatable, and they can work in it, sometimes with surgery, sometimes with medication. If, however, you have a PSA of 5.6 and you don't have an enlarged prostate and you don't have prostate issues, there is a chance, and it's probably a good chance, that it's prostate cancer. But I want to emphasize the PSA test is not a test for prostate cancer. It is a test that it's one of the markers of something to look at to further investigate. The only way you're going to know if you have prostate cancer is to have a biopsy. And even to this very day, imaging, MRI, nothing can tell you have prostate cancer other than an actual biopsy. And the reason for that is the only way they know, the doctors, the only way they can confirm prostate cancer is to do a chemical test. And the chemical test needs tissue. They can't image yet and say that's prostate cancer. Maybe that'll change in the future with AI and other techniques. But as far as today's technology, the only way you know you have prostate cancer is to indeed have a biopsy. But if you have a high PSA or a rising PSA and you're otherwise healthy, it's really good to have a biopsy, especially if you're at 5.6 or 6 or 7. Generally, they say, and I'm being very general here, when your PSA rises above 4.0, it's a time to kind of be cautious. If it keeps rising past 4 into 4.1, 4.2, 4.5, it is really a good time to get checked out. And most urologists will have different ways of doing some initial tests and screening, but a lot of times it is going to be a biopsy. And unfortunately, I've been through a lot of different experiences in my life with medicine in my body, and I think my biopsy was one of my least favorite. But anyway, that's just me. All right, next question. Here's a good one. How long does it take for testosterone levels to return to normal after finishing a 6-month hormone treatment like Orgovyx for prostate cancer? So medications like Orgovyx, Lupron, these are designed to bring testosterone levels down to almost zero. And in doing that, it inhibits prostate cancer from growing. So typically, Orgovyx, Lupron, these are used typically in conjunction with radiation. So if you're going to have radiation to treat prostate cancer or recurrence, they will put you on this hormone therapy, usually for 6 months. And it's you start roughly 3 months prior to radiation, you have your radiation, and then you're on it another 2 or 3 months afterwards. I guess that's longer than 6 months because the radiation itself can be up to 2 months. But basically, I did a whole podcast on what these ADTs do, and they deprive your body of testosterone. And as males, testosterone does a lot of things for us. It helps us to maintain muscle mass. It gives us our mojo, our sexual drive. It enables the production of semen and all these wonderful things that make us males. It also has an effect on mood, and I mentioned sexual drive, libido. So when you're on ADT, for many men, what happens is you lose sex drive, you're tired, you lose muscle mass, you just find yourself weaker. And there's certainly ways to thwart against that, and I've mentioned them before. And basically staying active, working out seems to do the job. But the question is, when does it stop? And the good thing about taking an ADT like Orgovyx or Lupron is that once you stop, your testosterone usually does come back. So that's great news. It's a very temporary medication, hormone. There are some differences. Orgovyx is a pill, whereas and you take Orgovyx every single day, whereas Lupron is a shot that you get once or twice. It lasts about 3 months. So when you're finished with these treatments, Orgovyx is going to be the fastest recovery back to full testosterone. And when I finished my radiation, I was on Orgovyx for another, I believe it was 2 months or almost 3 months, but it was a few months. And in the moment I stopped, I noticed within about 2 weeks, I noticed a phenomenal change. With that being said, I kind of got lucky because when I was on Orgovyx and I was working out every single day and I had a very, good mind, I lost some libido, but it wasn't lost completely. So I was able to summon up that sexual drive, if you will, just by really working on it. But it was a lot harder. And I would say I was a little more tired, but a lot of men go through a lot more of a rough time than what I went through. And I try to keep myself in shape, and maybe that helps. So once you stop Orgovyx, within about 2 weeks, you start to notice a difference. And within about a month or 45 days, you're progressively getting back to where you were. And I'm guessing by about 60 days, and I'm being very general, it's going to be different for everybody, but no longer than 60 days, and you're practically 100%. That's what I found. Lupron, on the other hand, works a little differently. When you get a shot of Lupron, it really tends to stay with the body a lot longer. So if you're on a 6-month Lupron regimen and they stop the Lupron, it could take months for your testosterone to come back, and in some cases, even up to a year. So that's another advantage to Orgovyx if you can have that instead of Lupron. The problem with Orgovyx is it's very expensive, and not all insurance companies will cover it. But in any case, the good message here is that once you come off of this hormone therapy, your body comes back, your testosterone comes back, your sex drive comes back, everything is great. Okay, so that's something to look forward to. Next question. For men whose PSA rises after prostate surgery, how do doctors decide when to start radiation or hormone therapy? And does starting treatment at a higher PSA, like 0.4, affect the results? Okay, this is like the $1 million question. So you've had your prostate removed, some time has gone by. If you start to see a PSA rise within a few months, then that's not so good. And it can mean a lot of different things, but in very general terms, the faster PSA rises after surgery, the greater the chance that you're having recurrence, and you're having recurrence quickly. And that's not good, especially since prostate cancer tends to be very slow moving in most cases. But let's just assume it's 5 years after surgery. In my case, it was 8 years after surgery, and my PSA started to rise. And originally, because I was doing testing every 3 months, it was always undetectable. And I never did the ultra precise test. The testing that I did for 7+ years always just showed me whether it was below 0.1 or not. It never showed me a lower number, because below 0.1, there will be small fluctuations. And the idea there is below 0.1, just consider yourself living life. There's no recurrence, nothing's happened. But then you might get a test that is 0.1 or then 0.11 or 0.15. And the question to ask yourself is, how quickly is that growing? And by the way, if your PSA hits above 0.1 and you're at 0.15, 0.18, and it's taken a number of years, you don't have to rush into anything right there and then for the most part, because it is very slow moving at that point. And also, a test of 0.1 or 0.15 doesn't mean you have recurrence. There are a number of reasons why your score can come up a little bit. And it could be something just as little as there was some tissue left behind that wasn't cancerous, but somehow is producing some of the PSA. But the bottom line is, if at some point your PSA hits 0.2, that's a large enough number where the experts tend to agree that practically the only reason you can be getting that score is because there are some cancer cells that are there. They may be dormant. They at that point, at 0.2, there's a very unlikely chance that they're sophisticated, they're moving around. They're just little seedlings that are kind of starting to wake up. And these seedlings can take years and years and years, decades to go anywhere. So that's also why as a man's PSA rises, we don't always jump into radiation right away. The specialists tend to say once you hit point 2, it's pretty definite that you've had a recurrence, so let's start treatment for it. In my case, I waited until point 4, and it took me about 2 years or so to go from point 2 to point 4. So I kind of had a false hope and did a lot of praying and just really told myself that at point 2, it would never get higher. And when I got point 2.5 and then point 2.8, very, very slowly over time, I said, at some point, I'm going to have to deal with this. And what I decided was, because of the slow rate of growth, that if I were to hit point 4, that would be the point in time that I would go and have radiation for the recurrence. If this would have been drawn out another couple of years, I would have waited because it's my feel. Now, the science kind of supports this, but I can't say this with 100% accuracy. But, if you're at that lower level, 0.2, 0.3, even 0.4, up to 0.4, you're still in that early stage and nothing's spreading, nothing's going around you. You're kind of buying time for something that could be inevitable. But my hope was if I never hit 0.4 and another 10 years went by, that would be 10 years without having to have treatment. But basically, at 0.2 and above, you're going to have to look at doing something to take care of yourself. And there are basically 2 methods of treating recurrence. One of them is to have radiation, and radiation usually does the trick in most cases. Not always, but in most cases. The alternative is to take ADT and different types of hormone therapy. And the idea at that point is to stop the growth of cancer, to reduce your testosterone to the point where the cancer can't go beyond 0.2 or 0.4, or in some cases just kind of like nullifies it. Doesn't erase it, but it just sort of like freezes it down, I guess, is the way to put at it. The problem with the hormone approach is that you will then live indefinitely with this hormone in your system. And I don't know if that's a great thing. I would say if you have to be on hormone therapy, then you have no choice. So, for example, if you have surgery and then you later have a recurrence, and then you have radiation for the recurrence, and then after that, there's another recurrence, then you almost have no choice but to go on hormone therapy at that point. So anyway, the simple answer, point 2 is a time to be of concern. But as with anything, whatever I tell you in this podcast, take my notes, always discuss what I mention with professionals, doctors, oncologists, because they really would have the answers for you. And I'm just speaking from what I believe to be true. I could be wrong, but I think I'm right. Anyway, all right, next question. So after radiation for prostate cancer, recurrence, what's the difference between continuing hormone therapy versus intermittent hormone therapy, taking breaks? And are there other things to think about? So there are a lot of studies. I can't quote any right now, but I've seen a lot of specialists talk about this that suggest if you are in a situation where you're on long-term hormone therapy, you're on ADT forever, there is evidence now, and I suggest you go and research it, but there's evidence that says you don't have to be on hormone therapy continuously. And you can take what's called a hormone therapy vacation. And sometimes it's 6 months off, sometimes it could be 12 months off. But I think what they're finding is you'll be on it for a while. And of course, you have all the side effects. And then you can take a vacation from it. 6 months, maybe 3 months, maybe 8 months. It'll vary for every person. But that is great news, because if you're on a type of ADT that dwindles quickly, like Orgovix, then you can have chunks of your life back at months at a time, 6 months at a time. You get your mojo back and everything, and then you go back on. And the idea there is you just sort of keep the cancer at bay. You don't eliminate it completely, but prostate cancer, when it's not aggressive, is very tameable, I think, is what they say. If you have very aggressive prostate cancer, that's a different story. But anyway, so there is such thing as a hormone vacation. And I think we're going to start to see a lot more information about that in the future. So there was one more question. Oh, yes. Actually, I didn't write this one down, but I remember somebody asking me for about this in the chat. So there is a gentleman who had radiation for prostate cancer, not recurrence, but initial prostate cancer. And a few months later, started to have urinary issues, lack of urinary control. And the question is, how could this be? Because, a lot of times men that have incontinence, that's a result of the prostate being removed because there's a lot of tender stuff going on down there with whether it's nerves. So the question becomes, how can it be that I have radiation and then I have continence issues afterwards? Well, believe it or not, that is related to the effects of radiation. And as I mentioned earlier, when your body's radiated, the radiation, it's really, I hate to use the word harpooning, but it's kind of harpooning through everything on its way in and on its way out. And it could very well be that the muscles that control urine flow, which include the prostate, if you still have it, and also the sphincter, they can be affected by radiation. It's something that I don't see frequently, but it does happen. And unfortunately, the resolution to that, the treatment for that is kind of out of the scope of what I can offer, but it is something to be discussed with your physician. And one thing that I'm always very happy to see is that with every year that goes by, because I had my prostate removed in 2015 and now it's 2025. But with every year that goes by, the treatment methods, the detection methods, the diagnostics, they improve greatly. And that is especially the case for post-surgery or post-radiation side effects. So I can't really give answers on how to get continence back after radiation, because that's a much deeper topic. But there are solutions, there are answers for that. And for any of you that have had surgery or radiation with further complications, don't let it just kind of sit and wait. Have it treated, have it taken care of. I'm right now, this podcast is being done in March of 2025. I had my radiation for recurrence in July of 2024. So that was last summer. And maybe I'm one of the lucky ones, but so far my PSA has remained as undetectable. And I will tell you, there's no greater joy once you've had recurrence and then you have treatment and then you get a PSA back that says, guess what? It's 0 or undetectable. It's great joy. So I am back to doing every 3 months. So far, I just had a follow-up in February. So far the radiation seems to have worked well. And everything in my body is back to where it should be, whether it's erectile function, continence. I had no side effects from proton radiation whatsoever, other than during the radiation, I had some stomach irritation, but that's just because, there's radiation in that area, but that went away quickly. And, post radiation, it's almost like nothing ever happened. I have no signs. Everything is working as it should be. Of course, I'm limited to the same effect, post surgery. So erectile function is possible. It's not as great as it used to be, but it still is there. Sexual function, orgasm is very pleasurable. It's there, but it's very different as well. So I guess the point is, whatever I ended up with after surgery, which I'm very happy with, there's nothing about sort of my post-surgery condition that I wasn't able to live with and not keep enjoying life with. The radiation had no net effect on that whatsoever. So as far as I'm concerned, it's like I never had radiation, other than the fact that the PSA is down to undetectable. So this is something that I maybe attribute to a couple of things. And I do try to take care of my body. I try to stay very optimistic. I'm in a very loving relationship. I have a family that I love. I have a purpose to sort of be here, for them, and to stay alive as much as possible. I think the mental state you have is as important as anything else. And it's not a surprise that some of the men that I speak to who are really in bad shape, whether after surgery or after radiation, it's not a surprise that they're not happy people. They suffer from depression. They have marital problems. They have money problems. They have all types of different things. And I think when your brain and your mind is down and out and depressed, your body does not have the ability to heal itself as well as it could. So that, that's not a scientific, assessment of how all this works. But if you can find it in yourself to stay as positive and happy as possible, then no matter what happens, whether you wear diapers, whether you take ADTs, you are alive. You have a responsibility to be there for the people who love you. And you just look forward to a very long life. So that's my philosophy lesson for today. And I'm gonna try to do some of these Q&As on a more regular basis. So I do want to thank all of those who participated. Look for more in the future, and leave me notes in the comments. I try to read as many as possible. Sometimes I don't get to answer them because I'm kind of busy leading a happy and working life, but I try my best to look at the questions in Facebook and in YouTube. So keep posting questions. And if any one of you can help just one other person understand what this whole process is, then that's paying it forward. And that person hopefully can reach out to others as well. I also highly encourage all of you to look at some AI tools to get some of the answers. And I did publish recently a ChatGPT podcast that just showed me asking ChatGPT different questions. The great tools out there, ChatGPT is a very good one. Grok, which is part of X now, is exceptional. And it's kind of a newcomer to the game, but Grok has been trained very, very heavily and deeply in medical interpretations. And so I sometimes will put a question into ChatGPT, whether it's a blood report, whether it's a question about prostate cancer or anything to do with it, and ChatGPT gives you some great answers. Grok does as well. Grok will be a little more detailed. And but these are great tools, and the information you get out of these AI tools is mostly correct, but it's not entirely correct. So I would never make a medical decision based on an answer from ChatGPT or from Grok. However, if you do have questions of concern that you ask these AI tools and you get a response that you want to look further into, this is what you should take to your doctor and have that discussion. And it used to be doctors hated when you did Google searches. Google medicine was, horrific, especially with prostate cancer. The very reason I started doing videos was because back in 2015, when I was diagnosed originally, I went to Google and started asking questions. And the only thing that came back in searches was just doom and gloom. So I would search, what can I expect from prostate cancer surgery, and everything that came back and said, your life will be over, your wife will leave you, you'll be in diapers the rest of your life, you'll never have sex again, et cetera, et cetera, et cetera. Now, sadly, that's the case for some people, but it's not the norm. So that's where Google searches were very dangerous. Nowadays, you can ask these AIs exactly what your concerns are, and you'll get some very good answers. So with that, I will wish you all well, a great month. And I want all of you to be as positive as possible about whatever you're going through. And if you're newly diagnosed with prostate cancer and you're watching some of these videos or listening to some of the podcasts, just hang in there. And the chances are, if you're early enough in detecting prostate cancer, you have a very good chance of defeating it forever. But further to that, even if you're a little further along, the science has come a long way that the chances of you dying from prostate cancer in today's world it's almost impossible to die from prostate cancer unless you've let it go to a very advanced stage and never had it detected. But once you're detected early, they'll find ways to kind of keep you going and keep your life happy. So with that, I will thank you again, and we'll see you next time.